In this session, we are going to be looking at the assessment of abdomen in specific to inspection. Hi, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the objectives that we'll be addressing in this session. An abdominal examination is a portion of the physical examination which a physician or nurse uses to clinically observe the abdomen of a patient for signs of disease. The physical examination typically occurs after a thorough medical history is taken. The articles required are gloves, inch tape, stethoscope, and scale. The following are the points that needs to be kept in mind while preparing the client. Before abdominal examination, the client is instructed to empty his or her bladder. Help the client to lie supine with arms folded across the chest or resting by the sides. Slightly flex the client's knees by placing a pillow or rolled blanket under the client's knees. This helps to relax the abdominal muscles. Drape the client with sheets so the abdomen is visible from the lower rib cage to the pubic area. Warm hands are essential for the abdominal examination, as cold hands can cause the client to tense the abdominal muscles. Instruct the client to take slow, deep breaths, as this promotes relaxation. The sequence of assessment of the abdomen differs from the typical order of assessment. The first step is inspection, the second step is auscultation, the third step is percussion, and the fourth step is palpation. Auscultate after you inspect so as to not alter the client's bowel sounds. The examination of the abdomen evaluates the following abdominal structures in the abdominal quadrants, such as the skin, stomach, bowel, spleen, liver, kidneys, aorta, and bladder. The abdomen is divided into 4 quadrants and 9 regions. The 4 quadrants are the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. The 9 regions of the abdomen are the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region, and the left iliac region. Let's look at the inspection of the abdomen. The first step being observing the coloration of the skin. The normal findings are the abdominal skin may be paler than the general skin tone, as this skin is so seldom exposed to the natural elements. The abnormal findings are purple discoloration at flanks. It is referred to as the gray Turner sign. It indicates bleeding within the abdominal wall, possibly from trauma to the kidneys, pancreas, or duodenum, or from pancreatitis. Yellow hue of jaundice. This is more apparent on the abdomen. Pale taut skin can be seen in ascites. Redness can indicate inflammation. Bruises or areas of local discoloration are also considered abnormal. The abnormal findings that are addressed here are gray Turner sign, the second one being yellow hue of jaundice, the marked discoloration can be seen, and the third one shows ascites. The next step is noting the vascularity of the abdominal skin. The normal findings are scattered fine veins may be visible. The abnormal findings include dilated veins, which is seen in liver cirrhosis, obstruction of inferior vena cava, portal hypertension, or ascites. Dilated surface arterioles and capillaries with a central star, otherwise referred to as spider angioma, may be seen with liver disease or portal hypertension. The next step is to look at any striae. Normal findings are old silvery white striae or stretch marks from past pregnancies or weight gain are normal. The abnormal findings include dark bluish pink striae, which is seen in Cushing syndrome. Striae may also be caused by ascites, which usually results from liver failure or liver disease. The next step includes looking for scars. Ask about the source of scar and use a centimeter ruler to measure the scar's length. Document the location by quadrant and reference lines, shape, length, and any specific characteristics. Normally, pale, smooth, minimally raised old scars may be seen. Abnormal findings include non-healing scars, redness, inflammation. Deep, irregular scars may result from burns. Keloids, excess scar tissue, can result from trauma or surgery. The abnormal findings that are addressed here are dilated veins, spider angioma, striae from Cushing syndrome, which appear dark bluish pink, deep irregular scars that result from burns, and finally the keloid scar. Assess for lesions and rashes. Normally, the abdomen is free of lesions or rashes. Flat or raised brown moles are normal and may be apparent. The abnormal findings are changes in moles including size, color, and border symmetry. Any bleeding moles or petechiae, that is reddish or purple lesions, are considered abnormal. The next is inspecting the umbilicus. Note the color of the umbilical area. Normally, umbilical skin tones are similar to the surrounding abdominal skin tones or even pinkish. Abnormal findings are bluish or purple discoloration around the umbilicus. It's referred to as the Cullen sign, indicates intra-abdominal bleeding. Next is to observe the umbilical location. Umbilicus is normally located at the midline, whereas abnormal findings include a deviated umbilicus, which may be caused by pressure from a mass, enlarged organs, hernia, fluid, or scar tissue. The next is assessing the contour of the umbilicus. Normally, it is recessed, that is inverted, or protruding no more than 0.5 centimeter and is round or conical. Abnormal findings include an everted umbilicus, which is seen with abdominal distension, and an enlarged everted umbilicus, which is suggestive of umbilical hernia. The abnormal findings that are addressed here include the Cullen sign, the deviated umbilicus, and the everted umbilicus. The next is inspecting the abdominal contour. Look across the abdomen at eye level from the client's head and from the foot of the bed. Measure abdominal girth. Normally, the abdomen is flat, rounded or scaphoid, which is usually seen in thin adults. The abdomen should be evenly rounded. Abnormal findings are a generalized protuberant or distended abdomen may be due to obesity, air, that is gas, or fluid accumulation, that is ascites. Distension below the umbilicus may be due to a full bladder, uterine enlargement, or an ovarian tumor or cyst. Distension of upper abdomen may be seen with masses of the pancreas or gastric dilation. 6 steps that need to be considered are fat, feces, fetus, fibroids, flatulence, and fluids. A scaphoid abdomen may be seen with severe weight loss or cachexia, which is related to starvation or terminal illness. The abnormal finding that is addressed here is a scaphoid abdomen. The next is assessing the abdominal symmetry. Normally, the abdomen is symmetric. Abnormal findings show asymmetry, which may be seen with organ enlargement, large masses, hernia, diastasis recti, or bowel obstruction. Abdomen usually doesn't bulge when the client raises head. Abnormally, a hernia, that is, protrusion of bowel through abdominal wall, is seen as a bulge. Diastasis recti appears as a bulge between a vertical midline separating of the abdominis rectus muscles. This condition is of little significance, usually seen after pregnancy. An incisional hernia may occur when a defect develops in the abdominal muscles because of a surgical incision. A mass within the abdominal wall is more prominent when the head is raised, whereas a mass below the abdominal wall is obscured. The abnormal findings that are addressed here are the first one being diastasis recti and the second incisional hernia. The next is inspecting the abdominal movement when the client breathes. Normally, abdominal respiratory movement may be seen especially in male clients. Abnormal findings include diminished abdominal respiration or change to thoracic breathing in male clients, which may reflect peritoneal irritation. Next is to observe for aortic pulsations. Normally, a slight pulsation of the abdominal aorta, which is visible in the epigastrium, extends full length in thin people. Abnormal findings include vigorous, wide, exaggerated pulsations, which may be seen with abdominal aortic aneurysm. Next is to observe for peristaltic waves. Normally, peristaltic waves are not seen, although they may be visible in very thin people as slight ripples on the abdominal wall. Abnormal findings include peristaltic waves being increased and they progress in a ripple-like fashion from the left upper quadrant to the right lower quadrant with intestinal obstruction. In addition, abdominal distension typically is present with intestinal wall obstruction. The following are the references.